What is genetic testing?
People get the wrong idea about genetic testing, I would say, and I forget the name, 23andMe, and the other one that traces your ancestry. Those are genetics of the body and the DNA that make up you as a person. That's not what we think of in terms of myeloma. Cancer is a genetic disease, and the genetics of that are abnormalities in mutation, chromosomal translocations from one region to another, mutations. I explained about mutations where genes are inactivated or overactivated, and then we're trying to get to grips with epigenetics. And so that's what we mean about it, is the cancer cells have gone wrong. And while it drives the whole cancer, we should see it as an opportunity, because the cancer cells have the mutations, which means there's something about the cancer cells that can be targeted by a therapy. And so if you can switch off the signals that keep the abnormal cells alive, because surely they should be dead, then they'll commit suicide. And a good example of that is when you target a gene called BCL2 with venetoclax. Turns out that the 11-14 subset of myeloma is exquisitely sensitive to that, commits suicide and dies. It's really important we study the genetics, because you can use it for many different things, including finding new treatments, predicting response to therapies, predicting the risk status for an individual person. So it's really important that we understand it all, because therein lies the secret to curing people.
So genetic testing traditionally means that we do a bone marrow biopsy and we get tumor cells purified out of the bone marrow that are the myeloma cells. So effectively, we look at the genetic changes that made the tumor start in the first place, but also can now, with new tools, look at how these genetic changes evolve and develop and change over time with ongoing therapies. So with that, we can gain more insight. Some of these are known to be predictive of outcome, of how patients respond to therapies. And as we know through very new insights with drugs like venetoclax, some of these can even help us tailor the therapy and select the right drug for the patient.
Would you talk about genetics in myeloma?
So why genetics? And before I do that, let me just say a few words. When it comes down to genetics in myeloma, what we're talking about is the genetic changes that happens in the cells that give rise to the myeloma. And I cannot emphasize this enough. We're not talking about genetics as we think of them, that we pass on from generation to generation. This is not the hereditary part of genetics. These are hiccups that happen in those myeloma cells that make them become the myeloma cells. In no small part, we know about this because of the work of people by Dr. Berg-Sago, that we understand that little hiccups is what gave rise to multiple myeloma. Now, like if you're writing a story and you put a typo, almost always nothing happens and you laugh and you see the typo. But every now and then, missing a comma or the wrong typo can change the whole meaning of a story. And that's what happens with the genetic changes in myeloma. Those typos, we know which ones they are. We know which ones are the ones that happen on a regular basis. And now what we're doing, and have been doing for some time, we can use that information to think, okay, this is a myeloma that is more likely perhaps to be a bit more aggressive, or this is a myeloma that's going to be more stubborn but less aggressive, or this is a myeloma situation where we have to think about a different drug. That is the value of genetics, number one. Number two, these genetics are not present in any other cell of your body. They're just exclusively present in the myeloma cells. So the muscle cells, the bone cells, our heart, our brain, everything is normal. It's just that little hiccups that happen, unfortunately, in the cell that gives rise to the myeloma cells.